Okay, I think everyone's in. We're waiting for a few more, but there's a few more that's going to come on in. But good morning, everybody. Welcome to our event at the Hub and Main Street Pharmacy. We're here to present to you our Lunch and Learn on Main Street Pharmacy, and they are here to talk about their wonderful services. And I am very excited that we've developed this partnership and collaboration, and they do amazing work. And we have a lot that's coming up. My name is Caitlin Comet. I'm an AmeriCorps Prevention Corps member serving at the Hub. And I am going to turn it over to Z. Just a moment. We have more people coming in. Sorry about that. Kind of pops up on my screen.
Okay, no worries.
Yeah. All right. Thanks for those of you who are just joining us. Hello. Welcome to our event. I'm going to send it over to Z Perupia, and she's going to start us off. I'm going to share my screen, Z.
Okay.
Whenever you're ready.
All right, ready. Hi, everyone. My name is Z. I am the PGY1 Clinical Pharmacy Resident at MSP, and I'm here with Annie.
Hi, my name is Annie, and I am a nurse, and I work here. And me and my husband, we are the owners of the pharmacy, and we are doing this because we really care about our patients, and we love what we do. And we are excited to be here and have the partnership with the Hub. Okay.
All right. So going over to the next slide for the objectives. We'll have a quick introduction, and then we'll show you guys a little bit of our care team, and then we'll talk about our services that we offer. Next slide. So once again, my name is Z, and I'm the clinical pharmacy resident at MSP. I'm originally from Florida, but I moved to Connecticut about a year ago in July of 2020. MSP is an independent pharmacy located on 2117 Boston Ave in Bridgeport, Connecticut. We've been around this location for about 12 years, and we operate a little bit differently than other pharmacies. We're not just a dispensing pharmacy. We offer a lot more services for all of our patients. So I'll show you the care team now. We have Andy, he's one of our pharmacists. We have Gene, you might see later in this presentation. He's the owner and lead compounding pharmacist. Then there's me, the pharmacy resident. There's Jalen, she's our lead retail technician. We have Marieli, which is our lead compounding technician. Joe, he's our operations manager. You met Annie, the CFO and nurse. And we have two medication delivery specialists, Christian and Ricardo. And these are all crucial in helping our patients and taking care of them. So a few of the services that we have to offer all of our patients would be medication management, adherence packaging. We do compounding, transitions of care, naloxone prescribing. We offer free delivery. We also handle pet medications. We're able to provide durable medical equipment. We do medication disposables, vaccinations, and we have some clinical services, and we hope to promote that and expand on them. We currently offer diabetic classes and pediatrics and more.
Okay, so let's talk about medication management. So when we say what is medication management and why is a pharmacy doing that? Well, isn't it a job of a pharmacy to manage the patient's medication? Yes, but like how we do it is completely different from other pharmacies, how they are handling their medication. So we started this program when we had our patients coming in and they have duplicates and and the doctors are having issues with what medication the patient is on, all these kinds of issues. And then we thought, you know what? Let's start this program where we can completely manage the patient and treat them as a whole. So what we started was okay, we are going to call the patient and the doctor and make sure that they are all, we have all their medication. So one patient will have multiple doctors. So it could be a specialist and a primary care doctor. They would have a cardiac problem. They would have a diabetic problem. So the specialists may not talk to each other. The primary physician may know that the patient is going to a specialist, but he is not aware of the medications. So what happens is that like the patients gets like duplicates of medications because the primary physician may give the diabetic medication, and the specialist endocrinologist also may give the same medication. So the patient end up not knowing what or how to take the medication. So we as a pharmacy and the pharmacists who are experts in managing the medication, we thought, okay, you know what, let's step and help the patient and make sure that they are on the right medication, and let's take care of them. Because when we started this program, we truly, like, we don't know how many caretakers came to us and said like, oh my God, this is awesome, because you know what, it took the worry off of our shoulders. And I think like how we're doing is like, when a patient comes to the pharmacy, we would reconcile all their medications. We'll call each and every doctor, and we would involve the caretaker. If it is a nurse, if it is like maybe like a daughter, a son, or it could be a spouse, anybody, we also involve them. And we make sure that like they know what we are doing. And we involve all the doctors too. And once we talk to all the nurses, and we reconcile all their medications. Once we reconcile all their medications, we set up a date of when we will deliver the medications. So once the date is set, we will fill, and it'll be like a blister pack. Do we have a picture of the blister pack?
Yeah, that's the next one.
Okay, so what we will do is like, we will have everything organized, checked, verified by the pharmacist, and for a month, and we will deliver that to the patient on the specified date. And once the patient gets that, if they have any question, it would have the name, what time each medication has to be taken. Everything will be on that blister pack, and it will be clear, and we are always available to ask or any questions, and that's how we give it.
What's crucial in the medication management is to make sure all providers, as well as the family and patients, are on the same page. So that's what we really strive to do, and to make sure that's one of the biggest ways to get rid of medication errors. All right, the next slide. So this is, Annie kind of touched upon this, it's the adherence packaging. I know it's a little bit blurry in the photo, but that's an example of our dispo packs. So like Annie was saying, we try to sync all of the patient's medications, whether that's 2 meds or it could be 25 meds. We do our best to find a way to get it all into one day, sync it onto one day, so the patient only has to come once, or we only have to deliver once per month, all the medications. So the picture you see here is our blister pack or dispo packs. Each pack will have your medication name. They'll be sectioned off for which time of the day to take them. They'll have your name, the date, the medications, how many medications you're taking. And on the very top, it'll go over what each medication actually looks like. So if there were any changes, your doctor told us mid-week or mid-month that you should stop this, and we can easily be able to talk to the patient and say, you know, you can take off that little green pill that has this on it. And so that makes it way easier for us to communicate with our patients on medication changes. These dispo picks are also really good because they can be easily torn off, and that makes it easier for the patients to take 1 day's worth or maybe 2 weeks worth off and just keep them in their purse or their backpack, wherever, if they're traveling, if they need to go somewhere, if it's an emergency.
You don't have to go with vials. You can just like take like the blister pack and just go.
Yes, it's so easy and so convenient, especially like I said, that top portion, because if a patient were to become hospitalized, all they have to do is rip out that top portion and the doctor will know every single medication that they're on. So yeah, if you are interested and you have patients or friends or family that have a busy schedule, they have multiple medications, they're not adherent, they're not compliant to their medications, this is one of the best tools out there to help patients get back on track.
Dee and Annie, if I can also just a comment here. And for those of you who are joining a little bit later, my name is Caitlin Comet, and I do Narcan trainings with the Hub. And we often see this dependency on certain pain prescription and pain management prescriptions develops from the diverting and sharing of prescriptions. So adherence packaging really helps individuals to keep track of their medications. And also for our elderly folks with some memory challenges, we see that this might happen where they might take their medication in the morning, forget that they've taken it, and take it again. So these adherence packaging is wonderful. I mean, I really love them. I want them for myself. So they really help in combating all of those factors that can lead to a potential opioid dependency. So thank you.
Yes,
You're
yes,
absolutely right. I know, because like we have our own parents on this, because then that takes that stress off of us, to say like, okay, did they take the, because I know like before what they would be like, oh, did I take the medication? Did I just take the medication? They'd be like wondering, and so it wouldn't work. So once we started them on this, oh my God, they're like, oh, they're ready 5 days before. They're like, I need the next one.
Yeah, and this is also a great tool for us to know that our patients are taking medications as they should, because we do call it advanced to set up the delivery for the next one. And if for some reason, they said, I need it quicker or I have enough, then that's how we know that's a problem to target. And then we fix that problem.
It's beautiful. Thank you so much.
Of course. Next slide.
Okay, next we'll talk about compounding. As of now, we are the only pharmacy in Bridgeport to do compounding. And we have been doing this for like maybe over 8 or 9 years. And this is, I think I really love this. I'm a nurse by heart. And I think like, we do a lot of topical creams, pain creams and all, which is really good. And we really recommend the patients to have that. And this is personalized. So when a patient goes to a doctor and they see that like, they have pain in an area, like, for example, let me say like a feet, what the doctor would prescribe would be a pain cream. So that would have the ingredients. The doctor would send that to us and we would make that in our lab. And we would give that according to what the doctor wants or what the doctor thinks would help the patient. So when they're taking the compounding medication, the medication is like, the advantage is that whatever the pain medication, it is not going systemic. So it is completely localized. So the patient would not have side effect. At the same time, they will be relieved of their pain. It's like, if you have pain in your leg, why do you need to take, gabapentin or ketamine or something like that for your whole entire body, which may affect your liver or which may affect because this is all metabolism, right? And
this also prevents like abuse and misuse of oral pain medications.
Right. And also like OxyContin, oxycodone, so when you have pain medications, which is like a big thing now, opioids, this gives the physicians also an alternative not to prescribe that a lot, and they can take care of the patients better in a better manner. So I mean, a lot of our physicians really love it, and this is and it's personalized. So like anytime the patient can call us and let us know if it is working or like if they need something. So we will be always talking to the doctors, helping them to, adjust the dose, because the pharmacist knows and they recommend, and the doctors work together with them and make sure that it is patient specific so that it really helps. And if there is any side effects or anything like that, which we have not truly heard, but they can always contact us, and and it's awesome. I think a lot of providers are now preferring to do compounds.
And it's not just for pain, it also can be used for like infections as well.
Right.
So there's solutions. Yeah, there's solutions, ointments, creams,
right.
A variety of different.
Like even
compounds.
for little kids who have like GERD, we have make solutions that would help the kid and would be less colic. And we've been doing this for a long time, and we have seen how it works, and we're very happy about it.
Thank you, Z and Annie. And we had some questions in the chat, so I just wanted to check in. Just going back to the adherence packaging and blister packs, do you charge extra when a patient requests blister packs?
So state patients, we do not charge them for the blister packs, but there is a fee of $10 a month for us to be able to gather all your medications and put them in the pack. Yeah.
We just like a minimal fee, and we just want to keep that because we just want some commitment from the patient too.
Absolutely. And we also have one more question, and I know we're going to talk about deliveries soon, but maybe you can answer quickly. Do you deliver to Norwalk?
Yes, we do. We deliver to Great New Britain. So like, so Norwalk is right in our, we almost go like 3 days a week.
Mm-hmm. Yep.
Thank you so much.
Yep. All right, and into the next one. So we also partner with certain facilities to help ease the transition of patients from that facility back to their homes. So we talk to the nursing staff and the doctors and determine the most up-to-date medications for the patient. And then we also provide a 2-week dispill pack for free of charge, just for them to try it out, to see if they like it. And then if they decide to continue with it, then we continue with it for the rest of their care. So this is a really good program for someone that's been in like a home and now they're trying to transfer back into their actual homes.
Yeah, so like when a patient is in the hospital, like, they are really cared for by the doctors and the nurses. So then there is no issue, like, when they have to take their medication and all. But when they come back to the home, they're totally confused. Their pharmacy may not be open. They would not get all the medications. Like, there'll be so many issues, and the doctors may not know which pharmacy to send, or so many issues. So like what we do is like, we would, if it's our patient, or we do work with a lot of facilities, like nursing homes. What they would do is like, they will send the referral to us, and the patient agrees that they want to be in the program. Once they agree that they want to be in the program, we will be reconciling all their medications, and we will be giving them 2 weeks of medication so that they can adjust. And if they love the program, they have a choice to go back to their own pharmacy, or they have a choice to stay with us, which is totally their choice. But like what we focus on is like just to help them and make them to stay home and feel better, because we don't want them going back to the hospital, because like that is hospital readmission is a big cost for in healthcare that like we can prevent, because like it's taking a lot of our tax dollars, and like we just want to make sure that like we can save that money and help patients to feel better and make them healthier.
Yeah, the patients have been through enough with all this transition from the hospital to homes. So one way that we ease their care and ease their ease of mind, their peace of mind, would be to provide that 2-week blister pack. All right.
So naloxone prescribing. So as a pharmacy, our pharmacists are certified to do the naloxone prescribing. Opioid crisis, it's a big thing. So we recommend everybody to have like a naloxone at hand, and this would be covered by the Good Samaritan law, because like if you can save somebody in trouble. And anytime like a person comes to us, we would recommend them to have a naloxone in their hand or Narcan, so that like they can help somebody in trouble. It may not be, even patients who may come to take syringes from us, we would recommend them and ask them to take naloxone. And they have been really willing, and because we speak to them openly, we do consult them. And we want to make sure that they're safe. We don't want to ever, judge them. And we want to be open to them and help them, because after all, it's a life. And we want to make sure that they are safe.
So if you or anyone just takes opioids, you can just call up our pharmacy, let us know. We don't need the doctor to write the prescription. We write it ourselves, and we can definitely get that for you. Because once again, like Narcan is a lifesaver. So it can be for anyone. It can be for your neighbor. It can be for your child. It can be for anyone you know. And obviously overuse or overdose of opioids is not always intentional. It can be an accidental. And this medication helps a person stay alive enough to when help can arrive from the hospital. So what we try to think of is Narcan as like a fire extinguisher. No one intentionally wants to set their house on fire. But if it happens, you need to be prepared and have that safety net for you. So.
Yeah. So
Thank
that's
you. That was beautiful. And we do have a question in the chat. Oops, I lost the chat. Hold on. Okay, are all pharmacists trained? And maybe we can, I think, Giovanna, do you mean trained to prescribe naloxone?
Yes.
Yes.
Okay. Wonderful. Thank you so much.
No problem. And the next service we have is free delivery. We at MSP understand it's a difficult time to leave your home due to the pandemic or due to factors that are out of your control. We know that some of our patients have limited mobility and other people may not have a reliable form of transportation. So, and also some people are afraid to leave their homes because of COVID. So we make it very easy and convenient for our patients by providing free delivery to many cities, by providing and going to multiple areas. We go near and we go far.
Right, and then now recently we have been doing curbside, delivery to make sure that we are following all the protocols of COVID. So whatever the patients want, we do help them. We do make sure that it's curbside, and we follow all the safety procedures. Okay.
Zia and Andy, maybe can you clarify? Do you have limitations for your deliveries?
Yeah.
Limitations for deliveries, like other places that we don't go to. So far, all of our patients have free delivery.
Right.
We haven't said no to anybody.
Right. We go to Seymour, we go to
Greenwich.
Greenwich. Like we do have patients all over. So once the patients have come to know about our service, I think they use us, and then it's hard for us to say no. I think because we love to take care of people and we want to make sure that they're cared for, and that is truly Gene. Okay, he wants to take care of people.
Yeah. So if anything, if we know that it may be a tough way, we'll work with them and try to find a route that we can take.
Okay, just to be clear, you do deliver medications to specifically Fairfield County, especially since we work with many of the towns here. The 14 towns that we serve are from Stratford all the way down to Greenwich. So if someone reached out to you and said, I'm from Stamford, Greenwich, you would be able to deliver medication as long as they're a continuing patient, correct?
Yes.
Yep.
Yes.
Perfect.
And pet medications. Okay, we all love our pets. And we do have, we do compounding for pets too, pets as well. And we do regular medications for pets as well. So when you go to a vet, they almost all the vets have their medications and you buy it from them. But sometimes if you don't want to do that, you can always come and get it from us too. Mostly what vets do is they give the prescription out, and then we would fill that here, just like any other regular medication. And also if metronidazole, what the vets don't have, we would make that for the vet, like ursodiol, metronidazole. There are so many compounds that and our dogs and cats and all our pets, they get the same things that we get too. And it's unfortunate. It was a new awakening for me, because I didn't know that dogs would get diabetes. But when I started here, it's I'm oh my God, they get that too. So how do we take care of that? So that's how and it is really interesting. And so we try to help our pets and anybody's pets that, who wants our help.
Another advantage is we can even sync your pet's medications to yours, so you can pick up both of yours at the same time. Okay, next slide. So we actually do have a DME, or durable medical equipment specialist. His name is Joe. And so basically, if you're injured, let us take care of you. We offer medical supplies, such as incontinence wear, wrist braces, potty trainers, walkers, and more. If you are in need of something, just give us a call. We can see if we have it, or we'll order for you if we don't, and be able to deliver that to you as well.
Right. Yeah, like wrist brace, a lot of things. So just call us, like if you need anything, and if any of your patients need anything, call us. We are fully accredited, and we can do that. So we can help you with, and we will take insurances too. It's not always cash.
Thank you. And also, I had a question about the pet medications, if I could just go back really quickly. But we also see in with individuals who might have a opioid dependency, using pet medications as a way to obtain certain pain prescriptions. Can you describe, give more information about how you might also be tracking pet medications?
Okay, so like the dosage of the medication, the pet's medication is always calculated, right? So like that will be entirely different from what a human would have. So, I mean, that is always taken care, and we are also talking to vets, and we would know. So if there was like, if the patient calls us and let us know, like, hey, my dog's medication got over, and like then we would definitely contact the vets and make sure, like, if what is happening, and not judge, but like we will definitely investigate and figure out to make sure that, like, we are doing the right thing for the pet, because here we are treating the pet and we want to make sure that the pet is safe, and so the vet knows about it.
And just as carefully as we track narcotics and controlled substances for our patients, we do the same for pets.
Right.
That's wonderful and reassuring to hear that your comprehensive care is really touching all bases. So thank you.
Thank you. Our next one is medication disposals. So I'm sure we all know someone that has pills that they don't use anymore because a strength changed or the whole medication changed itself. So we offer free disposable packets as well as a safe medication disposal box within our pharmacy. So basically, we understand that sometimes you don't need your medications anymore, or you're stuck with the wrong medication, and we don't want it to stay around in your house and be a hazard to you or someone else or your pets. So we like to take that off your hands in a judge-free zone and dispose of the medication safely. It doesn't matter what the medication is.
Let me tell you a story why we started this, okay? So Jean would love to go and meet patients. Sometimes, like, they're old and, like, they've been our patients for a while, or like they're new patients. Sometimes he would like go out of his way and try to help the patients. So one time, like, he went over there to a patient's house. It was a very old lady. Jean says it's very sweet old lady. So, like, and she didn't know which medication she was taking. So he said, okay, I'll come and help you. So he went over there, and he opened the bathroom cabinet, and all of a sudden there's like tons of vials, okay? And then he's looking at all these vials, and he's like, oh my God, there's enough to start a pharmacy here. Okay, and then those are also expired. And like, so she is like totally confused, and she doesn't know what to do or which one to take, because like she keeps getting more and more medications, and like, she's like, I have enough. So then, like, we researched, and we said, like, okay, is there a service like we can dispose patients' medications? So then we found out that, like, we can give it to the police stations, because like police station is where, like, you can return the medications. And recently, what we were approved by the state to take this project where, like, we can take back the patient's medications and we can dispose it over there. So then there is a complete process where, like, it has to be an authorized person, like, who would sign you off and put that medication over there and make sure that it's safe, and then they will come and pick it up so that it's disposed safely, because we don't want our medications ending up in the trash or, in this ocean and
Negatively affecting our environment.
right.
So,
Because we would just want to make sure that our, environment is kept safe too, and our patients are kept safe too. And our patients they know actually how to take care of their medication.
and some patients may feel like scared or judged if they have to go to a police office or a fire department to drop off these medications. So we offer them like the comfortability to just, do it with us. When you're picking up your next meds, drop off the old meds, or just come by any day and be able to drop off your old meds.
Okay, yeah, and that was medication disposal. And
All right, next we have is vaccinations. So some people may not know this, but you don't have to go to your doctor's office to obtain a vaccination. We do them in the pharmacy. All the pharmacists are trained to give vaccines. We're qualified providers, and we actually carry out many vaccines. So just give us a call ahead of time. We'll see if you have it in stock. And if we don't, we'll order it and be able to set you up with a date and time to get your vaccine. And right now we're actually offering the Johnson & Johnson vaccine as well as the Moderna vaccine. There's 2 ways you can sign up. If you or anyone else wants to sign up, you can either give us a call or you can go on our website, mymsprx.com, and sign up for either vaccine. It's your choice. And so if you just want one, schedule an appointment and we'll be happy to help you out.
yeah, and we want everybody to stay safe, and we have to get through this pandemic, please. So everybody receive your vaccination. Okay, and on top of all the services that we explained, we also have other things like clinical services, which Z is going to talk about.
Yeah, so what sets us apart from other pharmacies is we like for the ability for you to trust us with more than just your medications. We want you to trust us with your overall health. So we actually can invite patients in if they feel comfortable and offer one-on-one services. We can take blood pressure checks if you feel like your blood pressure is high or low. We're more than welcome to take that for you. We'll teach you how to use your blood pressure machines, your diabetic machines. We'll take your A1C levels, your sugar, your glucose. If you, like I said, if you have a glucometer or blood pressure machine and you just aren't 100% sure of how to use it, we'll teach you. And we offer counseling on all the medications and products as well. And then if you have a chronic condition like asthma or diabetes, we can offer interactive classes to teach you about your condition and to overcome the obstacles that you may be facing. So right now we have a diabetic class, and we are hoping to further that and make a pharmacogenomics, tobacco cessation, and asthma classes.
Right. And the diabetic class, it's like a 10-hour class, and it is all, okay.
Yep. And the next slide, we'll talk about the diabetic classes.
Okay, go ahead.
Okay, so diabetes it's a scary condition, especially if you're just diagnosed. So we want to help you take 100% control over your condition. We teach you how to understand your condition and how to properly take control of your blood sugars. We teach you proper injection techniques, proper medication use techniques, teach you what is an A1C, why do you have to take it every 3 months, what's your blood sugar goals, your blood pressure goals, how to properly do exercises, how to diet, and so much more. And at every visit, this is part of the DSME classes. It's a 10-hour class. And at every visit, we do take your vitals, your blood pressure, your height, weight, BMI. We track your whole progress, your respiratory rate, heart rate, and much more. So like I said, it's about 10 hours, which span over a couple weeks at the patient's convenience. Like I said, we know it's a hard time for everybody right now, and we really want you to understand why you have diabetes and how to control it. So we do it at the patient's convenience, and we track your progress with the doctor, with your whichever doctor. If you want us to do to your primary, if you're endocrinologist or both, we can do just meet up with them and talk to them about your progress. And the overall goal is to manage your diabetes in a safe and effective way.
And we have seen that, like, the patients who come here, they want to talk, they want to share everything with us, and we can really develop that relationship, and they want to do more. They want to exercise. They want to make sure they're eating healthy. So these are all the questions that we would help them with.
And we actually, like when one of the classes, we have the exercise class, we do the exercises with them to teach them and show them like, hey, like anyone can do it. You just have to try and make time for it. So yeah, it's a very interactive class. It's not just sitting down and watching a PowerPoint.
Okay.
That's great. Thank you.
And the next thing is pediatrics. So Jean is a pediatrist. So like diabetes and pediatrics, foot care go, close together. Diabetic classes, these are all like, go hand in hand. So like, at least it's recommended that you have to have if you're diabetic, you have to have your feet checked at least once a year. So when you are just like, in the initial stages of diabetes, like we're like, everybody would be like, oh, I'm fine. And they would not take care of their feet. So when when it gets more and more chronic and more serious, what happens is that we get our neuropathy, right? And also if we were not wearing our shoes right all along, what will happen is that our gait changes and our it's just our disease progresses faster, and we tend to develop more strain on our feet, and then it makes you like your leg will hurt, your hip will hurt,
Your quality of life will decrease.
right, and then you won't be able to walk and all that. So like everything, it starts from the feet, because all our weight is put on the feet. So like if you have a good shoe, if you are walking on the right shoe and all, it would help you because you can balance. Sometimes like when we are standing for a long time, our heel hurts, our, we don't have the anchor support. All that stuff can be taken care by a podiatrist, because what the podiatrist would do is would assess your feet and get you the right shoe. And most of the patients who have diabetic, if it is recommended by the patient, I'm sorry, if it is recommended by the provider, they will get one pair of shoe every year, and with 3 inserts. So because I think Medicare, CDC, I think wants to make sure that our patients are, we can prevent from what is happening, because in the later stage, they would have to go through surgery and all that stuff. So because of that, if they take care of their feet earlier and make sure that it is taken care, we may not even have to end up with the surgery later on in the stage. So I think it is recommended to wear the right shoe, and always we can have the podiatrist assess your feet and make sure you have the right shoe. Okay.
And at the end of the day, we just want you all to know that we are here for you. We're here to help you. Feel free to come by our pharmacy or call us if you have any questions or want to know more about our services. We're here to just build a safe and healthy community and provide resources to patients, all of our patients or non-patients, in a judge-free zone.
Okay.
Thank you so much. Does anybody have additional questions?
I do have a question. Can folks hear me?
Yes.
Yeah, my name is Stella. I work with Beacon Health Options, the ASO that manages Medicaid in Connecticut. And my question is, do you have a list of services that are covered by insurance, and then the list of services that are not covered by insurance, but you take cash for them, so that someone can just look at that quickly, and if you're trying to help somebody, you understand which services can be accessed by insurance and which ones can't. And I'm asking that question outside of Medicaid as well, not just Medicaid.
Okay. In general, we take all insurances. Okay, so we try to make sure, even for compounding or for diabetes education or blister pack and all, we make sure that the patient doesn't have to pay. We always try to see the various ways to make sure the patient can be given the medication free and the insurance would take the cost. That's our goal too. And as of now, all our diabetes classes, it's not covered by Medicaid, but we have been giving it as a free service just to make sure, because we know that where we are, we are in a area where like there's diabetes is very prevalent, and we just want to make sure that we can start taking care of our patients and make them understand and make them healthier. That's our goal is. So that's why we started this as like a free program, and we just make sure like that we help them to understand. And we want more patients coming in, and we want to develop this program, and that's our goal.
Okay, thank you.
And we will give you a list, okay? Stella?
Yeah, I was gonna say, we don't have a list right now. We have just a list of all of our services, but I can definitely make you a list of services that we have that are covered and versus services that you can pay cash for. I can definitely send that to Caitlin or to you directly, whichever you prefer.
Yeah, I think that would be really helpful.
That would be excellent. Thank you.
Yes. Thank you, Stella. And that would be really helpful because we do have a lot of providers that are trying to connect individuals to care. So it's really helpful if we have that information right away instead of going through many different hoops to kind of figure out where is services and how is it accessible. So that would be beautiful. Thank you so much.
Okay.
Does anyone else have any questions? Okay.
Oh, I don't have a question. I just have one additional comment. This is Stella again. Since you're going to make that list, can you also clarify which services you offer to folks that are homebound? That would be good to know. Yeah, thank you.
Sure.
Okay.
Thanks, Stella. Thank you, Z. Thank you, Annie. This was really helpful and wonderful. I was very happy that you made the time to come present and talk to us. And it's really important that we are aware of this information and all of the services that you provide, and also very helpful that it can be accessed throughout the state as long as, you know, it's reasonable. And I really appreciate everybody participating and for your time here. I am so happy we have this collaboration. MSP are really advocates for care. And they provide that individualized, comprehensive, consistent care. And so that's really important for our communities. So thank you, Z, thank you, Annie, and thank you to your team for all the work that you do for our communities in care, and also in ways that you're combating the opioid epidemic and all of those prevention strategies that you do. So it's really important for me, and I'm sure for everyone here. Thank you for your time.
Thank you. That's so sweet, Caitlin. Thank you for allowing us to present here and giving everyone a chance to know our services. Thank you so much.
Absolutely. Thanks,
All right.
everyone.
Thank you so much, everybody.
Have a wonderful day.
Bye.
Thank you. Bye. Bye, ladies.
Bye.
Bye-bye.